Good morning. You're watching Colorado&Company, and we shift our focus to a discussion of your health and a topic that people may find a little uncomfortable talking about. But the fact remains that IBS and other belly issues affects 1 in 5 people in the U.S., and many people have learned to just live with it. But why would you? Irritable bowel syndrome affects 1 in 5 people in this country. It can be very painful, debilitating, often resulting in stomach cramping, excess gas, constipation, even bloating. Dr. Marie Starling is a specialist in internal disorders and functional medicine in the Denver Tech Center. She's been practicing for 15 years and is trained in chiropractic, nutrition, acupuncture, allergy elimination, and functional medicine. And it's nice to see you.
Hello.
So I've talked to you before on the show, and I think we should kind of start with your own personal journey because you had experience with this before.
I did actually. In my family, we have what's called the celiac gene, which is the gene that codes for an immune response to gluten, but we didn't know it. It also is one of the major causes of hypothyroidism and autoimmune conditions that attack other areas. And so I had all these GI symptoms that I didn't know what to do about, and we finally figured it out, and my mom and my daughter have it, and so we don't eat gluten, which is great fun, let me tell you.
Yeah, but it's a life that a lot of people deal with. And what are some of the signs of people who suffer from IBS?
Well, IBS is a catch-all phrase, and it's basically a diagnosis of exclusion. And what that means is that, and this is a picture of your GI system, which can be inflamed with any kind of gastrointestinal issue, and that can create the symptoms. So with IBS, it's a very, very commonly used term, which means we don't know what's wrong with you. We can't diagnose you with Crohn's disease or ulcerative colitis. You don't have a tumor, but you've got problems. And when you have it, you know it. You don't feel good. It can cause a lot of inflammation that can cross into the brain and create a lot of brain fog or fuzzy thinking and fatigue. It can create a lot of gastrointestinal symptoms as well, bloating and constipation and diarrhea, and I eat something and my stomach's upset and I don't know why. And so it's really a big mosh of stuff. And so my job is actually to distinguish the different areas, what's really going on and what's the really underlying cause.
So we get the answers when we come to you, which is nice. It's not
true.
like, oh, you got a GI problem.
No, and it's very hard actually to differentiate which one is going on. It takes a lot of work, and a lot of testing. So we do a lot of specific testing to get to the root cause.
Okay, but there's a lot of people who suffer from that in our country. Why is there such a big impact in our country with it?
Well, it's a huge conglomeration of things, and one of the reasons is that we have the 3 most common allergenic foods in our diet is wheat, corn, and soy, and those are the 3 foods that we eat every meal all day long for years and years. And then we have blood sugar issues, which cause us to become more sensitive and start attacking foods more sensitively. Our immune system to start attacking things more vigorously than it should. And then we have a number of other reasons as well, but it's really how we eat and what we eat combined with stress, and it's just a nice little pool for us to create a big mess, basically.
So if you don't have a healthy digestive system, can this lead to other problems then?
A healthy digestive system is critical for having a good immune system. 70% of your immune function occurs in the GI tract. It actually is critical for detoxifying substances that shouldn't be in your body, right? It also is necessary for you to absorb your nutrients and your minerals, which is what you build everything with your body. Which is what you build everything for your body from. And then also you have to have non-inflammation to feel good. You can't be inflamed.
But you are successful at diagnosing this. I mean, we were talking about earlier, there are so many people who go to other doctors and visits and they just say, IBS, and they don't actually narrow it down. So what are you doing that's different from others?
That's a very good question. I routinely see patients who've been failed by 3 to 5 doctors, and it's not that they're not doing a good job, it's just that they don't look at use the testing maybe that we use. We can use, we actually run gene tests to see if you've got the gene for gluten. We can run blood sugar tests to see if you've got a blood sugar issue. We run a full lab panel and we look at all the subtle issues. This is a picture of the 14 components that you can actually have an immune reaction to for gluten. And when you get a blood test to see if you have celiac, they're checking for one of those components. So we see a lot of people falsely misdiagnosed as non-celiac. And then there's also, this is a slide that actually talks about cross-reactivity. So food allergy is a huge component to the irritation of the GI tract, which makes sense really if you think about it, because what you eat comes in direct contact with your GI tract. And so these have to be ruled out as possible irritants or causes of inflammation as well. And then of course the other component would be, that's not on there, it would be infections, parasites and bacterial imbalances and fungal overgrowths. And so you can actually have infections, you can have allergies, you can have an autoimmune response.
And not even know it.
And not even know it.
So it seems like there's a lot involved. Take me through an initial consultation when a patient comes to see you for the first time.
What I do is I do a full history, and I also do a full physical exam. So I actually check not only their physical signs, but also some neurological screening to check for the brain function, because brain controls your whole GI tract as well as everything in your body. And then I do a full record review. So we have them bring all their records from all the other doctors that have been done. And then we frequently have you get a lot of testing. So we have you get, not a lot, but some testing. We can actually see a lot from a blood panel with antibodies to different areas. We'll actually have you do a gene test if we need to determine if you've got a gluten gene. We'll have you do the panel that you see right there is Cyrex Labs. They're not open yet. They're teasing us.
Oh.
I know, they're not quite there, but they're supposed to be any day. So we'll be able to run a full 14 panel plus cross-reactive foods soon. And so then we can figure out, you know, this is the fights. And that's my job. My job is to identify what the fights are and then go after them.
Okay, so once you go after them, what's the treatment?
We use a combination of dietary modifications, healing medical foods, nutrients when needed, supplements when needed. Sometimes I'll refer you to another doctor if you have a fungal infection that's kind of chronic, and we treat that because it's very hard to get rid of. So I have a great MD who does treatment for that. We'll use, sometimes we'll use allergy elimination.
There's a lot of options, it sounds like.
Yeah, sometimes we have to balance the brain, and that's, you know, with structural.
Balance the brain. I need the balance of the brain right here. What kind of special do you have for Colorado&Company viewers?
I believe that we put together a special for 15-minute consultation, and it's a $150 value. So you can come in for 15 minutes, and we'll find out if it's a good fit for you and if what we do is a good fit for them.
Very nice. Well, interesting. I've learned a lot of new things that I had no idea about. Thank you.
Yeah, absolutely.
Again, you too can finally find a solution to that pain and the problems of irritable bowel syndrome and other gastrointestinal issues. Give Dr. Starling's office a call today to see if you would be a good fit for treatment. The number 303-721-9800. That's 303-721-9800. Be sure to take advantage of Dr. Starling's special for the first 30 callers who mention Colorado&Company. Dr. Starling is offering a free 15-minute initial consultation that instantly saves you $150. Don't delay. Pick up the phone. Call 303-721-9800. You can also learn more about the Healing Center by going online to thehealingcenterdenver.com. And the caring professionals at the Healing Center paid for this segment.